Hello, welcome to the presentation on the Haddon Matrix and Public Health Emergencies and Disasters as part of the Program on Occupational Health and Safety Education on Emerging Technologies, Mid-Atlantic Partnership, or Pocket Map. I'm Dan Barnett from Johns Hopkins Bloomberg School of Public Health. Let's discuss some background about the Haddon Matrix and about Dr. William Haddon, who is the creator of it. Here are the learning objectives for this presentation. We'll talk about the development history of the Haddon Matrix and ask for you to be able to describe it by the end of the presentation. We'll link injury prevention epidemiology and all hazards disaster preparedness in the context of the Haddon Matrix. We'll describe the Haddon Matrix's use as a planning tool. And last but not least, describe the Haddon Matrix's applicability to the all hazards preparedness model. Let's begin by introducing a little bit of background on Dr. William Haddon Jr., who was the creator and innovator of the matrix that currently bears his name. So for a bit of background on Dr. William Haddon Jr., he had a background in injury epidemiology, specifically traffic-related injuries. He was the first director of what is now known as the National Highway Transportation Safety Administration. And his challenge back in the 1960s, when he developed this matrix, was to identify innovative and effective approaches to reduce highway traffic injury and death. So that was his target. And the challenge that he was addressing was that traffic safety educational programs simply were not having the desired impact on reducing traffic-related injuries and outcomes. So William Haddon had a transdisciplinary background in medicine, public health, and microbiology. Dr. Haddon came up with an innovative and elegant approach to address this challenge, by which he thought, what would be a good approach to understand the factors that contribute to traffic-related injuries before, during, and after the injury-causing event, in this case, the moment of impact in a highway traffic accident. And in doing so, he wisely incorporated the epidemiological triad of host, agent, and environment, as we'll see in greater detail. The result of this thinking was the phase factor matrix. He did not name it after himself. It became named after him subsequently, but it initially was called the phase factor matrix. And it went through several iterations, and the final version that's in use today and that we'll present here was established in the early 1980s. So it's been around for several decades at the time of this recording. Dr. Haddon had a transdisciplinary background in medicine, public health, and microbiology, and these various disciplines coalesced very helpfully in the way he thought about analyzing the complex and challenging problem of highway traffic injury and death. In fact, he was also an out-of-the-box thinker, and he early on realized that the application of this phase factor approach could also be used to address a polio outbreak. So in 1968, he published on that dimension. Importantly, the Haddon matrix, as we'll see visually in a moment, comprises rows which reflect phases. And by phases, we mean pre-event, before, in the case of a car accident, before the moment of impact. And that aligns with what we call primary prevention in public health. The event phase, which is at and immediately after the moment of impact, which constitutes secondary prevention. And following the moment of impact, the hours to days to weeks to even years following such an event, which constitutes tertiary prevention.